Today we will be discussing about the blood supply of the nasal septum and the lateral wall of nose. First, I will talk about the blood supply of nasal septum. Nose receives blood supply from the internal and the external carotid arteries. Imagine the nasal septum. Look at the picture. We can divide the nasal septum into 4 quadrants with an imaginary line drawn horizontally and vertically. So there is an anterior and posterior quadrant and an antero-superior and antero-inferior quadrant, postero-superior and postero-inferior quadrant. The superior quadrants are supplied by the internal carotid artery branches. The inferior quadrants are supplied by the external carotid artery branches. Let us come to what are the external carotid artery branches. 2 arteries come from the external carotid system, that is from the facial artery and from the internal maxillary artery. The major branches are from the internal maxillary artery. From the facial artery, there's a superior labial artery. So, septal branch of the superior labial artery. So, it supplies very anteriorly. The caudal septum and the columella, it is supplied by the septal branch of the superior labial artery, which is a branch of the facial artery. From the internal maxillary artery, you have 2 branches, greater palatine and the sphenopalatine artery. So, the greater palatine artery enters via the incisive foramen and it supplies the antero-inferior part of the septum. The postero-inferior part of the septum is supplied by the Sphenopalatine artery. A main artery that you have to remember is the posterior septal artery, which is a branch of the sphenopalatine artery. The posterior septal artery is the basis of the nasoseptal mucosal flap, which is a workhorse in our skull-base surgeries. Coming to the superior part of the septum is supplied by branches from the internal carotid artery. The internal carotid artery gives its first branch near the skull base only. From the skull base, it gives the ophthalmic artery. From ophthalmic artery, you have the anterior ethmoid and posterior ethmoid artery. Anterior ethmoid artery supplies the antero-superior part of the septum. Posterior ethmoid artery supplies the postero-superior part of the septum. One more important thing that you have to know is the anterior part. In the anterior part, all these arteries come together. You have the anterior ethmoid, greater palatine, sphenopalatine, and also the facial artery, the septal branch of the superior labial artery. All this come together in this area known as the Little's area. These arteries form a plexus and these terminate here as a rich vascular capillary loops. This area is very vascular. So anterior bleeding, anterior nasal bleed, anterior epistaxis most commonly occurs from this area, because this area is more common to trauma from the turbulence of airflow and also due to digital trauma. You can injure this area and profuse bleeding can occur. What is the venous drainage of the nasal septum? So anteriorly you have the facial artery, I told, to anterior most. So similarly, anterior part of the septum drains into the facial vein. Posteriorly, it drains into the sphenopalatine vessels and into the pterygoid plexus. And one important thing is superiorly, the ethmoid veins can communicate with the superior ophthalmic system, and there can be direct intracranial connection through the foramen cecum into the superior sagittal sinus. Coming to the blood supply of the lateral wall of nose, it is the same as that of the septum. You have the internal carotid artery and external carotid artery system. Imaginary line, you divide it into antero-superior, antero-inferior, postero-superior, postero-inferior. The superior part is supplied by the internal carotid artery, inferior part is mostly supplied by the external carotid artery system. From the external carotid artery system, the most important 2 arteries are the sphenopalatine artery, the greater palatine artery, and also you have the descending palatine artery. The sphenopalatine artery supplies most of the lateral wall of the nose. A small area along the anterior aspect of the lateral nasal wall is supplied by the facial artery. Facial artery branch is also known as an angular artery, supplies the anterior part of the lateral nasal wall. And the inferior part of the lateral nasal wall adjacent to the palate is supplied by the greater palatine artery. Remaining everything also supplies by the sphenopalatine artery. What about the internal carotid system? You have the anterior ethmoid artery and the posterior ethmoid artery. Both are branches from the ophthalmic artery from the internal carotid artery. What about the venous drainage of the lateral wall of the nose? It is almost the same as the nasal septum. Anteriorly, it goes into the facial vein. Middle part goes into the pterygoid plexus. Posteriorly, it drains into the pharyngeal plexus. In brief about sphenopalatine artery, the sphenopalatine artery is the main supply of the nose, and it travels via the pterygopalatine fossa and it enters the nasal cavity via the sphenopalatine foramen, which lies just inferior to the horizontal attachment of the middle turbinates. Sphenopalatine foramen. So it's a foramen between the sphenoid bone and the palatine bone. The sphenopalatine foramen is formed by the sphenopalatine notch of the palatine bone in articulation with the sphenoid bone. Superiorly, you have the body of the sphenoid. Anteriorly, orbital process of the palatine bone. Posteriorly, sphenoidal process of the palatine bone. Inferiorly, perpendicular process of the palatine bone. This forms the sphenopalatine foramen. Coming to the clinical significance, we have to identify for ligation of the sphenopalatine artery in cases of epistaxis that require a ligation. Most common landmark that we use is crista ethmoidalis. It is a small crest on the perpendicular plate of the palatine bone located anterior to the sphenopalatine foramen, and it serves as a consistent landmark. Sphenopalatine foramen also contains the nasopalatine nerves. So posterior nasal neurectomy. You can revise the previous video on vasomotor rhinitis. The sphenopalatine artery can branch at the area of the sphenopalatine foramen. So 95% of the studies show that there are 2 or more branches of the sphenopalatine artery medial to the crista ethmoidalis. All this has to be identified and ligated for a successful endoscopic ligation of the sphenopalatine artery. If it is not possible, we will have to go for ligation of the internal maxillary artery in the cervicopalatine fossa. About anterior ethmoidal artery, this anterior ethmoidal artery traverses 3 compartments, which arises from the ophthalmic artery in the orbit, and it traverses between the superior oblique muscle and the medial rectus muscle in the anterior ethmoidal foramen. Here we can identify it in the CT, and then it traverses the ethmoidal cavity obliquely in a posterior to anterior direction. It can be either within a bone of the skull or within a mucosal mesentery. Then it goes intracranially into the olfactory fossa via the lateral lamella of the lamina fibrosa. In the intracranial cavity, it gives off the anterior meningeal branches, and then it re-enters into the nasal cavity to the cribriform foramen, and then it supplies the nasal septum and the lateral wall of nose. So this is the blood supply and the venous drainage of the nose, septum and the lateral wall of the nose. You have to keep this in mind before you read and study about epistaxis and treatment for epistaxis.